Good evening and welcome to the CCH Weight Bias webinar. It is a one-time only webinar and we hope you will enjoy it enough for us to repeat it in the future. My name is Mila Solankulova and I am the Marketing Manager at the College of Contemporary Health, otherwise known as CCH. You have probably received CCH obesity news bulletins and various toolkits from me before, if you are subscribed to CCH. If you are not a subscriber, I highly recommend you sign up for a breadth of free resources that we share monthly on www.contemporaryhealth.co.uk/subscribe. CCH has been entrusted by the London Borough of Southwark to deliver Southwark Healthy Weight training. It is aimed to equip all public-facing professionals in Southwark with skills to successfully manage patients affected by overweight or obesity. CCH also provides a range of CPD-accredited short courses covering a range of topics such as nutrition, childhood obesity, fitness essentials, and living and working with obesity. Please check the courses on our website. Tonight, I would like to welcome our guest speaker, Joe Nadglowski. Joe is the CEO and President of Obesity Action Coalition, an American national nonprofit organization dedicated to giving a voice to the individuals affected by obesity. The title of this webinar is Understanding Weight Bias. Obesity is quickly becoming a global epidemic, and each day health organizations are recognizing more and more that this is a serious chronic disease associated with more than 70 related conditions, such as diabetes, hypertension, sleep apnea, and more. While the recognition of obesity as a serious disease is becoming more prevalent, we still face a large hurdle in addressing obesity when it comes to weight bias. Individuals affected by obesity face weight bias in many facets of life, such as employment, education, healthcare, and more. Weight bias persists as one of the last acceptable forms of discrimination and limits our ability to fully address obesity from all sides. The purpose of this presentation will be to educate the participants on the existence of weight bias, its impact, and what we can do to eliminate it and address this global epidemic. Let me now pass you over to our guest speaker, Joe Nadglowski, to expand on this more. Over to you, Joe.
Thanks, Mila, and thanks to the College of Contemporary Health for inviting me to be here today. I'm coming to you from Tampa, Florida, where it is early afternoon, and actually we're having a bit of a thunderstorm outside right now, so if you have a little background noise, we'll just assume that's Mother Nature giving applause to my presentation. Just kidding, of course, but in all seriousness, we are here to talk about a serious topic called obesity bias or weight bias. And the reality is I get a couple reactions to this presentation. I give it quite often. And the first is that I see bias everywhere. And the simple reality is that's probably true. I see it pretty much everywhere. And you'll see that throughout the presentation today. But I think I want to point something out, is that I don't think all bias is intentional. I think bias often is done on a naive basis. People engage in it thinking it's okay when the reality is it's not. They don't recognize the harm it does. And that's why I do these talks, is to help them better understand that maybe you are doing some harm in kind of just adopting these what are perceived as normal attitudes towards people with obesity. The other thing this presentation is it's a little bit tough on healthcare providers. The reality is that there are good healthcare providers out there, but there are some that have obviously harmed the patients that they're supposed to be caring for. Almost all of us who live with obesity, myself included, have had a negative experience with a healthcare provider about our weight. And they do have a big influence on our lives and our health. So I will say that healthcare providers are part of the problem, but I do want to say that there are good ones out there. And then finally, before I dig in, I wouldn't be able to give this presentation without the assistance of Dr. Rebecca Poole from the Rudd Center at UConn. A lot of the anecdotes you'll hear me talk about today are mine, but the data that's in this presentation is what Rebecca put together, Dr. Poole put together, and so she deserves much of the credit for this work. So moving forward here, and I'm having a little, all right, we'll get the slides to advance. Okay, figured that out. So moving forward here is just a quick overview. I'll introduce my organization because I think it's important you recognize my biases before we talk about bias, and then we'll really jump into bias itself, going through definitions, showing you some examples, talking about how prevalent it is, the impact it has, and how we can make bias, how we can try to reduce bias. So my organization is the Obesity Action Coalition. We're based in Tampa, Florida. We are now 13 plus years old. And we're an organization of individuals who live with obesity. Some of our members woke up this morning and said, today's the first day I want to do something about living with my weight or addressing my obesity. Others have been dealing with this issue for their entire lifetime. And we are very proud of the work we do. We're actually created after a legislator in the US stood up and said, I'm asked every single day to do something about the obesity epidemic, but it's always by a healthcare professional or a public health official. It's actually never by someone who has experience with obesity. And so we were created to fill that gap with the mission to elevate and empower those affected by obesity through education, advocacy, and support. And we really operate under a few core values. First, the one is important to our talk today, which is simply that individuals affected by obesity should be treated with the same level of compassion, dignity, and respect as those with other serious medical conditions. We're not asking to be treated differently, we're just asking to be treated the same. The second is that when people are ready to address their obesity and they want to address their obesity, individuals should have access to an insurance coverage for treatments of obesity. And unfortunately, in the US, this is not often the case. Oftentimes, the care for obesity is actually excluded from our insurance products. And then finally, no one should be stigmatized because of their weight, because they've chose to seek help, they've chose not to seek help. The stigma should just not exist. It is really a challenge in our society. And in fact, many of our members tell us it is actually the stigma of obesity that is the worst consequence of obesity, not the health problems, but the stigma of obesity that impacts them the most. And as I mentioned before, we were created to fill this advocacy gap, and we do so by having this nationwide network of members, although many of our members now are around the globe as well with the dawn of the internet. And at the very end of this talk, I'll talk a little bit more about OAC's education services and how you can be part of our community, time permitting. But with that being said, let's jump into the topic at hand, which is weight bias. And it really is my belief, and OAC's as well, that bias is important because it keeps people with obesity from asking for help, and it keeps professionals from offering it. It is the last socially acceptable form of discrimination. What often shocks people is that here in the United States, unless you live in the state of Michigan, you are not protected because of your body size. So for example, you could be fired from your job today because of your body size. You could be denied renting an apartment or buying a home because of your body size, et cetera. It is not illegal to discriminate in the US against someone with obesity. It definitely hampers our efforts to effectively combat the obesity epidemic. It is, as I mentioned before, one of our biggest challenges is this access to care issue. And again, because people think obesity is a simple problem of personal fault, this keeps us from taking concerted action around access to care and giving people access to treatment. So that's another reason why bias is important. And then finally, I think it's important to recognize that we all have bias. And, you know, if we had more time today, and maybe this was in a different format, I would actually have given you a little test called the implicit association test to help you recognize your own biases that you might have. And all of us have bias. And I've given that test hundreds of times, and I've taken it just as many. And I still have biases as well. So it's important that you recognize it, because once you recognize it, you can start working on it. So I've said the word often here. And so what does it really mean? What is bias? And bias is simply negative attitudes towards people with obesity. It can lead to worse things such as stigma, rejection, prejudice, and discrimination. It can be verbal, it can be physical, it can be relational, it can be cyber, it can be real, it can be perceived. So for example, in that case, which is not on the slide, but I say it often when I give this presentation, I give my own circumstances. One of my very first experiences with a healthcare provider about my weight was very negative. And so then I assumed everyone else after that would be negative towards me as well. And that was perceived bias. I put that bias on my healthcare providers, even though they themselves had never treated me poorly because of my weight. And then of course, bias can also be subtle, and it can be overt. And when I say these things, I say, well, it's probably often just to give you examples. So I'm going to share with you some things we've experienced in the US and around the world when it comes to bias. Here's a slide with lots of different images that you see here, and we'll touch on these, but that is a real Facebook page. Fat kids are harder to kidnap, and there really are apps that try to make you look heavier than you are. And these are the kind of things that we deal with all the time at OAC in the US, and I'm sure these problems exist around the rest of the world from talking to my colleagues from there as well. Now, a couple of examples. This is a billboard campaign that they actually did in Florida, not far from where I live in Tampa, Florida, that was put on by the people for the ethical treatment of animals. I'm a little concerned because I don't think they're very ethically treating people themselves with this campaign. This one, in my opinion, all it did is teach young children to refer to women of larger body sizes as whales. And I actually think that a vegetarian lifestyle would benefit many people with obesity, but I guarantee you no person became a vegetarian because you referred to them as a whale. And unfortunately, we see these kind of campaigns too often. You know, we see things like this in the US as well. This is one of the first issues OAC took on many years ago. We actually had an insurance company that made you prove that you were smart enough to have an obesity treatment, in this case, bariatric surgery. That's a real thing, and for never in the history of U.S. medical care was someone required to have an IQ test to be able to receive care. And this, of course, as you see here, made news all across the U.S., and this policy eventually disappeared. But it was a real policy and another real example of bias, probably a blatant, overt example of bias. We've also seen it in our politics, and I'll talk more about this later with another example, but it wasn't too long ago that our own president got caught up in this issue as well when his health records were released and his BMI was 29.99, right? And it wasn't 30. And many people thought, well, no, the president has obesity, but he said his BMI was not that of someone having obesity. It was called the girther movement here in the US. But what was interesting to me is that it really doesn't matter, right? If your BMI is 29.99 or it's 30.01, the health consequences of that little of a difference in BMI is not overly different. Yet again, you saw how our society reacted and said, you know, come forward and saying he was being dishonest or someone was being dishonest about it when it's really no one else's business, right? The only business of someone's BMI, just because you wear your weight doesn't mean it's anyone's business other than you and your healthcare provider. So shifting gears, those are some examples, but now I'll go into the data and talk to you about why bias is a priority. Simply put, there are millions of people affected by obesity, so therefore there are millions of people affected by stigma and prejudice. There are serious consequences, and we'll talk about those, whether they're psychological, social, or economic. There are pretty significant impacts on health. There's this definite reduction of quality of life. As I mentioned earlier, young people often report to me that it is actually the stigma of obesity that's the biggest challenge in their life. And you'll hear me say it over and over again because this is the area I work. It stops us from being able to address this issue when it comes to policy and treatment, because again, people think this is a simple condition of personal failing instead of a much more complex one. This is a little bit of an odd slide in that it compares discrimination, but I think it's important to say, hey, we talked about what bias is before, but now we're going to talk about the worst part of it, which is what it can lead to outright discriminating against someone. And so this is some data that's been collected that shows, if you look at the bars here, and I guess the purpler bar is women and the lighter blue bar is men, and I apologize, I'm not great with colors, so you might see that slightly differently. But you can see from this data that if you are a woman, the most likely reason why you're going to be discriminated against is your gender, right? Is because you are a woman. However, the second most likely reason is because of weight. Now, for men, we do not see this same trend. It is very different. And if we look at this data in a slightly different way, you see it right here, and you see how early it starts with women. Women start facing discrimination because of obesity at much lower body weights. And in fact, some face discrimination just in the overweight category, and then more in those that have obesity, and then much higher, close to half of those who have severe obesity. And if we think about when I use this terminology, severe obesity is my term for class 3 obesity, or someone who has a BMI over 40, about 100 pounds or more overweight. And you see that with gentlemen, with men, it does not necessarily start to happen until they reach that severe obesity part. But definitely is true that women are more vulnerable to weight discrimination than men. Now, curiously, there's been some new data that's been published recently that I got to comment on that suggests that we see with younger men, we start to see trends very similar to those of women, where we actually are seeing in those of younger age that there is a growing stigma for men around their obesity as well. And I think this is probably not surprising for those of us that are in this space, because in this world, you know, we're trying to say that obesity is bad, because for most of us, obesity does have health consequences. But what we want people to understand is that the people with obesity are not bad. And unfortunately, in our efforts to make obesity bad and get everyone to be aware about the crisis that obesity potentially is, we've somehow made the people with obesity bad as well. And that is a huge, huge problem, in my opinion, and sets us back to being able to do something successfully around this issue. So why do we see this? Why do we see all this discrimination? Why do we see these things? It's because bias is reinforced in lots of places. And I'm going to highlight some of those for you today. We won't go through all of these, but I'll hit the highlights of a number of them so you can actually see examples of why we think that bias is so rampant and why it's so harmful. And so when we look at the mass media, you know, whether it's television or movies or news media or newspapers or magazines, you see these pretty stereotypical portrayals of obesity, and you see people with obesity. They're there, but they're often ignored. There is this reinforcement of the social acceptability of bias. You know, it's okay to make fun of the person of a different body size. Late night comics are allowed to tell a fat joke, while they're not allowed to tell jokes about other topics. And, you know, when I say that reinforces it, well, just think about that. You hear that joke, and then maybe you repeat it the next day at a water cooler at a family event, or you share it on social media, et cetera. And this really does affect the public's perceptions about obesity. You know, if we looked very specifically at TV and film portrayals, there actually are, at least in U.S. television, very few characters with obesity on TV. And when they are, they're in these stereotypical roles where they're considered unattractive or aggressive or cruel or having no friends. There are very few positive social interactions or romantic relationships between people with obesity in television shows. For those of you that are from the U.S. or watch some U.S. television, we have a couple of notable exceptions. One show just went off the air called Mike and Molly, which featured two characters in a romantic relationship who both suffered with obesity. And curiously, when that show first started, the network received complaints from the public saying they didn't want to see two people of larger body size engaged in a romantic relationship. Think about that. People took the time to write a television network about fictional characters on a show they don't have to watch, which here in the US, there are 400 other shows on at the same time. It doesn't make sense that people would do that. I mean, again, it speaks to that issue that somehow we've made people with obesity bad as well as obesity being bad. With that being said, there are some notable exceptions on the positive front. We actually have another show in the US called This Is Us that features a character played by an actor named Chrissy Metz, who is deemed to be one of the most realistic portrayals of someone living with obesity. So I will say the negative outweighs the positive more often, but I will say it's nice to see some people trying to do a realistic, real-world, fair presentations of people living with obesity. And weight bias increases with when people are exposed to TV, film, video games, and magazines. And this just makes sense, right? As I mentioned earlier, you hear the joke, you repeat it, you thinking it's okay that you make fun of people in a certain way. You look at an image in a magazine and you think you're supposed to be remarkably slim and have this unrealistic portrayal of beauty and or health. And so this is probably just common sense, but the data repeats it over and over again. Now we think about our news media and you think, well, maybe they do this a little better, right? Are they better? Do they shape the way we look at obesity in a different way? And I'll tell you that if you switched over to Google, don't do this because you're supposed to be watching me, but if you switched over to Google and you opened another frame, you went to Google News and you searched obesity, you'd find one of these 9 images in the top 50 stories or images very similar to them. And this is how we typically portray obesity in news articles. The person's sedentary, they're eating poor quality foods, they maybe have a tape measure wrapped around and not wearing the most high quality clothing. And then, of course, my pet peeve, which is they're almost always headless, and we'll talk more about that in a minute. Here's a couple of news articles I'm picking on our friends at ABC here in the U.S. Today. If you look at the one on the right, scientists discover genes that control obesity. The reality is if we change that to any other condition, diabetes, cancer, you name it, we put the name in there. The picture is going to be a DNA helix or a picture of genes or the genome. It is not going to be someone pinching their belly fat, but this is typically what we see in these kind of articles. We see this kind of imagery. And so Rebecca Poole and her colleagues actually did some work at the Rudd Center and collected data around how people are portrayed in online news reports and the images that are there. And I mentioned that comment headless before. You see that very strongly here in their work. If the person was so-called non-overweight or normal weight, only 6% of the time were they shown without their head. But with people who have obesity, we show them nearly 60% of the time without their head in these kind of things. And then flip the characteristics and look at the positive characteristics. People with obesity are very rarely shown wearing professional clothing in these images, only 11% of the time in the study that they did. And you see the data, how much more it was for people who were so-called normal weight. And actually, here's the data again, looking at that looking at online news stories, but then if there was a video associated with it, and I guess it's a little more difficult to cut someone's head off in a video, or it's seen as less good format, but you still see the headlessness being represented there, and you still see the differences in the way professional clothing is worn as well. So I think our media is likely unintentionally, by where they buy their B-roll and or their stories, contributing to bias as well. Moving in their news reporting. And here's a summary of that data. 72% of images stigmatized individuals with obesity, 65% of videos did. Stigmatizing images really worsen public attitudes. Non-stigmatizing images improve the public's attitudes. And the public is tired of it. They're really tired of the stigmatizing images. They want us to go non-stigmatizing. And I think you see this in the backlash against Photoshop in magazines, and some of the things you see around people standing up to fat shaming that's often happened in some of the celebrity press. And although it is very rare that those people that are shamed in the celebrity press actually have obesity, they are being shamed for their body size. So it is, in my mind, at least progress when we see those kind of activities, and we see people standing up and saying, don't make fun of someone or give them a hard time for being a few pounds heavier than they had been in the past. Other places where we see bias, it's in our political cartoons. We're going to talk a little bit about politics here in the US. And so these are cartoons that appear in our papers. This is Eat Less Fatso, making fun of our food pyramid. We don't have a food pyramid in the US anymore. We have a plate. There are just as many of these kind of cartoons around the plate as well. I mentioned the politics earlier with President Trump, but there was another candidate for president. He didn't win, obviously, because President Trump won, but who was also deemed to be too fat to be president of the United States, and that's Governor Chris Christie, who has an interesting story because I think, although the media decided he was too heavy to be president, he is one of the few public figures in the U.S. has gone very, very public with his story about living with obesity and seeking help for his obesity. And when he did so, it was one of the first times in a long time I can remember that someone went public with their story and nobody popped out of the woodwork and said, well, you should have gone on my diet or tried my exercise program. Governor Christie had a bariatric surgery procedure. And in the American public's eye, he was someone who needed a bariatric surgery procedure, and they didn't give him a hard time for doing it. And I think that's a slight change in our attitudes here because, again, there's a stigma about having obesity, but there's also a stigma about needing help for your obesity. And in Governor Christie's case, he overcame that. Now, he's very public with his story. He has very severe obesity, and so maybe that's the public's okay with that in that situation. But to me, a small sign of progress in moving towards changing this issue of stigmatizing people for needing help. So I'm going to shift over now and talk a little bit about bias in the workplace. And this is another area where we receive all kinds of reports. And again, as I mentioned earlier, you're not really protected in the U.S. by laws that make it so it's illegal. And some of you have probably seen the kind of studies they do to do this, or even seen news agencies repeating these studies where they basically take someone who is normal weight, send them in for an interview, and then they take the same person and put them in what's called a fat suit or an empathy suit. And of course, the slim person is almost always hired. And again, the data bears this out, right? There are inequitable hiring practices. It's more difficult to get hired for a job if you have obesity. You face prejudice from your coworkers, you're assigned lower wages, you see more disciplinary action, among other things. And, candidates are less likely to be hired. They're perceived as a lower or poor fit. They have a lower salary, and they're evaluated less favorably. And there's really a penalty in the US. And this is some interesting data, because this data shows a difference in wages between both men and women in the US with their salaries. And there's newer data that's come out that actually suggests women earn up to 15% less than their normal weight counterparts if they have obesity. And men, it's almost a break even at no change in pay. And as I mentioned earlier, people with or men are less likely to be impacted by bias as much as women are. Although there was some interesting anomalies in the data, and further research is needed, but the data seems to suggest that if you're a Latino descent in the United States, you actually earn a little bit more money if you have obesity. So something for the researchers to continue to dig out. But again, that trend where women are the ones who struggle the most with this is definitely repeated over and over again in this research. And women report not only wage penalties, but the way they're treated in the office as well. And this is, again, a big study that looked at whether people face prejudice not only from their bosses and their employers, but from their coworkers. And you see the data there. It is a remarkably challenging thing to have obesity and be in the workplace and be surrounded by some of the programs that are put forward to supposedly make people well in the United States. We have these things called wellness programs that in many cases people with obesity perceive as actually being penalties, and not so much about them being well, but penalizing them for struggling with their weight. And then, of course, we talk about healthcare. And this is the area I mentioned earlier. I'm a little hard on the healthcare providers. And we see pretty highly documented levels of bias among all the major healthcare providers. This data, their bias levels are equal to or greater than that of the general public. How do they view people with obesity? They view them pretty much the same way. The news media tells us that they should be perceived, right? Or the mass media says they should be perceived, where people are perceived as non-compliant, lazy, lacking self-control, awkward, weak-willed. It's the same things that you saw earlier. And I think this, one thing that there's a real opportunity is for better education about obesity in medical training will take this away, right? I think right now the vast majority of healthcare providers are getting their knowledge about obesity from the mass media and not from their healthcare training. And so I think one way we can combat this is to improve healthcare training for them to better understand this. Physicians specifically, I'll pick on them for a minute. As patients' BMI increases, physicians report, look at that when they're less desire to help the patient. That's you have a pretty complicated condition in obesity and you have less desire to help somebody. That is disappointing. Part of that may be based on frustration because we haven't had tools or options to help people lose weight. There are more and more of these coming forward every day. And then again, hopefully better training will change that moving forward in the long run. And then nurses as well. So you imagine looking forward to see how nurses view people with obesity, and the statement that stood out to me where that 24% agreed that patients with obesity repulsed them. And I always think to myself, imagine what a nurse sees on a daily basis and it's obesity that repulses them. It's hard for me to understand that. And again, not all our nurses feel this way, but it is what this one study showed, and I thought it was important to share. I also will say some of the bias that nurses face towards obesity is that they're the ones who often have to move the larger patients. And for many years, they didn't have the right equipment or right training to do so. One of the things we can do to reduce nurses' bias is to actually, again, get them training in their medical training, but also teach them how to use the right equipment to avoid injuring themselves and moving people of larger body size. And so what happens as an individual if you are stigmatized because of your weight? Well, obviously you feel berated, you feel disrespected, you're upset. You perceive you won't be taken seriously. You report that your weight is blamed weight is blamed for all your problems. In fact, there's a quote that's used here in the United States quite often where you could appear at your healthcare provider with an axe sticking out of your head, and your healthcare provider would say your head hurts because you're fat. And so, but this is a real problem, and many patients do report that obesity is blamed for all their problems. Now, obesity causes many health problems, but it doesn't cause every health problem, and I think it's important that people recognize that. And this really makes people reluctant to address their weight concerns. And of course, if you're a patient or a parent of a child that has obesity, you feel especially blamed and or dismissed. There are not a great deal of options for people who are adults who have obesity. There are even less options for children who have obesity, and it makes it especially challenging. You know, the folks at the Red Center, when they were collecting some of these stories, you know, the last one on this list stands out to me, which was, you know, once I was going to have surgery, I'd be taken to the basement of the hospital, be weighed on the freight scales. I've never forgotten the humiliation. You know, there's really no excuse that this happened anymore. The scales that weigh to higher weights are widely available. You know, when you schedule a procedure for a patient, you should know that that patient has a larger body size, and there, at least here in the US, there are at least 1,000 bariatric hospitals. So this should not happen in today's day and age, but it still does, and it's unfortunate. And you just have to remember that once somebody's treated this way, they're not going to re-engage with the healthcare system. They're going to run away from healthcare, and they're only going to get sicker and sicker if they were sick in the first place. So this really affects quality of care. And again, if you look at people who have obesity, on average, they spend less time in their doctor's appointments than someone who doesn't have obesity. So you have one of the most complicated health problems people can have with lots of comorbidities associated with it, yet they spend less time in the doctor's office. That just amazes me. And I think that's partially based in bias. That's partially as me as the patient being afraid to talk to my doctor about my weight, and the doctor not wanting to bring it up because either they're not trained to do so or they're uncomfortable to do so. And then so neither of us do, and the reality is we have a really short visit. But that's not good for patients in the long run. More people need to be comfortable having these conversations, both from the patient and the healthcare provider perspective. Does this impact care? And yes, it does. So patients with obesity are less likely to go for their preventative screenings, to get their cancer screens, their pelvic exams, or mammograms. Kind of the horror stories and the notes we've received here at OAC are heartbreaking when family members share their experiences. You know, my aunt was stigmatized by a healthcare provider, and then she never went back, you know, for her annual physicals and things of that nature, and she died because of an undetected cancer, et cetera. Those unfortunately happen too often. And the reality is those of us who struggle with their weight are more likely to cancel or delay appointments. I'm a person who's dealt with this myself. I know in one of my own experiences in trying to lose weight, I delayed my annual physical because I know I'd gained weight that year, and I delayed it for about 6 months without a consequence. But, you know, it was me saying, hey, I can lose this weight and I don't want to get made or given a hard time by my healthcare provider about my weight. And so I delayed it. Curiously, when I finally worked up the courage to go in and have that go into my healthcare provider didn't bring it up, and she was walking out the door. And healthcare providers hate this, and you say one last question as they're walking out the door. But then I asked the question, could we talk about my weight? And actually, she set me on a journey back towards better health. But it is interesting to see that, you know, many of us think, hey, just give me a couple more months, I can get this weight off. And the reality is that you get caught up in this unending cycle of actually never making it to your healthcare provider. And I put this on the slide, and I apologize, the formatting's off slightly there on my screen at least. You know, if your doctor stigmatizes you because of your weight, how do you react? And I remind folks of those bottom two items. I'd seek a new doctor, I'd avoid future health appointments. 40% of their business is walking out the door. So when I train healthcare providers about this, I remind them of this, that, hey, you need to treat your people with dignity and respect, because otherwise you're going to lose them to the care that they need. So this is a really cool visual graphic that Rebecca Poole and her colleagues put together. I've known as a cycle of bias and obesity. And if you look at obesity rates in the US, they're at least leveling off in general, getting kind of flat at close to 40% of the population, which is a significant number. But if we look at the rate of people who have severe obesity, it's still growing dramatically. And in fact, in just the last 5 years, the number of women with severe obesity has close to doubled in the US. And there is some belief that people start in the top right-hand corner here with obesity. They face the health consequences of it. They go to the healthcare provider more often. They have these negative experiences in the healthcare environment. They continue with all these negative emotions that are associated with it. They avoid healthcare. They have more unhealthy behavior, more poor self-care, and they are caught up in this cycle. And this may be contributing to that dramatic rise in the number of people who have severe obesity. So I've talked a few things already about this, about the consequences of weight bias. But I will say that there are social, psychological, and medical consequences. There's social rejection, especially in younger ages, lower peer acceptance, worse relationship quality, poor academic performance. We see some avoidance in school. We haven't talked a lot about kids today. We could do a whole separate presentation on bias in kids and bullying and things like that for those first categories. And I mentioned the hiring practices and the lower wages and prejudice from employers as well. You know, one of the things I will tell you, and I'll spend a second on this slide, is that we have a lot of folks who engage in bias, and usually I have to call them up and I say, you know, why did you do that? And they almost always tell me that they did it because they were trying to motivate someone to address their weight. And then I point them to this data, which basically suggests that if people are stigmatized because of their weight, they don't actually lose weight. They gain weight because they engage in binge eating, they cope by eating more food, or they go into some kind of crazy yo-yo diet, which ultimately usually sends them on the upward trend for weight, not a lower trend. And so this idea that, you know, if you make fun of someone and you're helping people is a false one. And, or if you're trying to motivate someone by giving them a hard time, it's definitely a false one. And this was tough for me to accept, you know, in all my years of life and all the people I know who have struggled with their weight. And maybe when I looked at myself and my own views, you know, and those of my family members and others, you know, I've given them a hard time about their weight before, especially before I struggled myself. And I thought I was doing it out of love or caring or worry that, you know, they would be sick or not around, but I was actually contributing to their problem or contributing to the problem. And so I would ask you if you see yourself in this boat today, or if you see yourself having engaged in this behavior, let folks know that, you know, you're sorry for that behavior. And the reality is it may have been your lack of knowledge around this, and that you may have contributed to their problem, not helped them. But you can make up for that. And I've done this in my own life where I actually talked to someone who I'd previously stigmatized because of their weight. And it's changed our relationship. Of course, they blew it off and said it was never a big issue. But now they actually have real conversations with me about their weight in a constructive way, which they never had before. So it is a one small way that you can go back and try to fix something if you see yourself having engaged in this behavior in the past. And here's the data again that shows around, and this was a study of women that shows how eating is a common coping strategy to stress, and we covered that already. Now, of course, if people eat more because they're stressed and because they're stigmatized because of their weight, this obviously, it's common sense, it impairs their weight loss efforts. It causes them to have higher calorie intake. If they're in a weight loss program, they're more likely to drop out of it. They have less weight loss. This causes them to avoid physical activity. You know, we hear all kinds of stories of people being made fun of at the gym or out exercising because of their obesity. Just drives me crazy. We don't make fun of an alcoholic or someone with alcoholism going to an AA meeting, yet we make fun of someone with a larger body size going to the gym to try to get healthy. That it just doesn't make sense to me. And of course, that has all kinds of other impacts on cardiovascular health and causes poor quality of life. So a couple of strategies to reduce your own bias. I mean, just ask yourself what assumptions you have about a person with obesity. You know, the example I like to give is, say you see someone walking down the street and they weigh, you know, 300 pounds or 150 kilograms. And, you know, you make an automatic assumption that they have an unhealthy lifestyle and have engaged in bad behavior. But if you've never met them before, you don't know if they weighed twice that a year prior and they've done something truly remarkable and lost a dramatic amount of weight. So please try not to judge somebody when you first meet them. Try not to have stereotypes. Try to treat them with dignity and respect, the same kind of compassion, dignity, and respect you would want as if you had a health problem that was visible to the public. It takes small steps. It takes each of us on an individual basis to start to do this. It also takes us on an individual basis stepping up and standing up for someone if you see them being treated poorly. Remember that most people with obesity have tried to lose weight over and over and over again. In fact, some people have given up, but almost everyone has tried to. And people with obesity likely have been stigmatized, especially women, because of their weight at some point, especially by a healthcare provider. Obesity is not simple. It's a product of many factors: genetics, environment, our environment makes lifestyle changes very, very difficult, and it is definitely more than just personal responsibility. Yes, you are responsible to deal with the hands of cards you've been dealt in life, but you don't have to do it on your own. You can seek help and get help to do it moving forward to try to be as healthy as you can be. Language is important. Watch the language you use. The words like obese and fat, etc., are often very, very stigmatizing. Simply talking about weight in general usually works the best. We have adopted in the U.S. this view of using people first language, where we don't use the word obese anymore. We say people have obesity, just like people have diabetes or people have autism. I would encourage you to adopt that language as well. And then I'd also just encourage you to be really careful in how you communicate about obesity. We know obesity is a crisis, but we don't need to, obesity itself is bad, not the people who have it. And sometimes when you see, the example here in the middle, he has his father's eyes, his laugh, and maybe even his diabetes. We're making the people bad, right? Not the condition. And so we have to be very, very careful with the way we put this kind of materials together. OAC offers resources to help people make sure they use the right kind of imagery. And it's not only OAC who does this. We have partners from around the world, those in Canada, Europe, and the World Obesity Federation also has these kind of images. And if you visit our image gallery, you can find more, and I'll link you to the other image galleries from around the world. Here's my cheat sheet of what to do and what not to do. Watch the headless images. If you're ever doing a presentation on obesity, please, take out your headless images, watch the language. Fat jokes and humor. I wish we could joke about this, but we're not there right now with where we are, especially joking about treatment. So I would encourage you to avoid doing that, especially jokes that are directed at an individual. Be respectful, right? Be appropriate. Make sure people are shown in the way that you would want to be shown. So here's my summary of the bias information. It's prevalent, it's pervasive, it really harms people, whether it's psychological or physical, and it really makes obesity worse. And the reality is that people are heavier today because of bias, not lighter. And it keeps us from doing something as a nation here in the US and as a world around obesity as a whole. So I promised I'd end and just share a little bit with you about my organization. We offer all kinds of educational resources, some of which you can see here on the screen, all directed towards those who live with obesity, from our Understanding Obesity brochures, which includes an excellent brochure on obesity stigma, to our magazine, which comes out quarterly and features all kinds of novel articles on obesity and living with obesity, to our different brochures, especially one that we're proud of called Understanding Your Weight Loss Options, that goes through the pros and cons of obesity treatment in a very, very balanced way. All these resources are available to you to download from our website, a couple more highlighted here. You can visit our website and find more information about our community, the individuals who make up our organization by visiting obesityaction.org. You'll be invited to join our community there. It is free to join our community and receive our resources, and very much hope that you'll consider, after hearing today's presentation, be part of our organization, no matter where you are, whether you're a healthcare professional, a patient, or just a general interested member of the public. So here's that website address again, and I'm going to turn it back over to Mila to lead the Q&A.
Thank you very much, Joe, for such a mind-blowing presentation. I'm sure we all learned a lot about weight bias, and this is an issue that cannot be undermined or ignored. So now we would like to go to questions, and just to give our listeners maybe a couple of minutes to gather their thoughts and pose some questions. Just to remind to everyone who has joined us a bit later, you can post your questions into the chat, and Joe will answer them. So I may start with a question for myself, really. I mean, you've mentioned quite a few techniques, and I was just wondering, if you're a health professional, a nurse or a doctor, what could you really say or advise to your patient who has this unhealthy weight to empower them and, to make sure that they actually don't deter their next health check? And maybe you can draw parallels from your own experience because you have had a very successful journey. Thank you.
Yeah, so that's a great question. So what I often ask or encourage healthcare providers to do, and every system is different, but in most places you have an intake form where you fill out a little bit of information before you as a patient go back to see the healthcare provider. And I often suggest people actually put a little note on there to say, hey, is it okay if the healthcare provider talks to you about your weight? And most people, because again, they're nervous about bringing it up, may say yes. And that's easy. Then if they say yes, then the provider can have that conversation. If they check no, then the provider can take a little bit different approach. They can say, hey, look, I know you checked no here on this, and you weren't ready to have a conversation about your weight, but I just want you to know that this is a safe place to have that conversation. I'm here to have it with you when you're ready to do it. I think we have this tendency to try to want to force people to be ready to address their obesity today. And the reality is, and I found this in my own personal experience, unless you can make addressing your obesity your number one priority in life, it is awfully hard to be successful at it. And not, if someone else is having another major health issue or they're having family issues, it's often hard to make it that number one priority. And it may be better to actually wait and actually have a different kind of effort with that patient and then come back to them, weeks, months, or even years later to have that conversation.
Brilliant, thank you. We have some more questions here. So Nick has just posted, is there more stigma for someone who elects to have bariatric surgery versus someone with obesity who decides to lose weight without it?
Yeah, so there's actually some interesting data, not a lot of it, but there is some data that suggests that when someone loses weight without medical intervention, society sees them as in a better light than someone who loses weight with medical intervention. And so the reality is that there is a stigma around using bariatric surgery or, say, pharmaceutical interventions, which are available in many parts of the world now to address your obesity, that doesn't exist if you so-called did it on your own, which is kind of a, in many cases, a false concept, but and something we need to combat, right? So somehow you've cheated if you use medications, you have surgery. And I think that's something we need to convince the public that needs to change, right? The reality is if your health is impacted by your obesity and you need help, the fact that you tried to do it on your own and you're continually unsuccessful, you shouldn't, it shouldn't be not okay for you to seek help from somebody else, meaning you need medications and or surgery to do it. I think part of that, to address that, will take up more people who have had surgery speaking up. We have lots of people who do that now to talk about how surgery is not the easy way out, and it is actually challenging. A lot of people who have had surgery have long-term challenges because of their surgery, but many people still remain somewhat private about their surgery, or they're public that first year after they have it, and then they don't talk about it anymore. And we need more people who are long-term surgery patients to step forward and talk about that experience, that try to help reduce some of those perceptions.
Perfect, thank you, Joe. We have a question here from Stuart. What interventions are effective in reducing weight stigma?
Yeah, so if we think about how we would define interventions, I think one of the things, the simplest things that I often engage in to try to reduce bias is if I'm having a conversation with someone who is obviously biased, I spend time actually trying to convince them not that bias is bad, but that obesity is complicated. And we actually see from the data that if people recognize that obesity is not simply just about a personal failing, that they're less likely to engage in bias. I think that type of activity is it's challenging at times, because if you have somebody who comes forward and says, look, no, I have to tell it as it is. These patients are blah, 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 and they need to do this. And then I have to remind them about, well, what about this? What if they have a genetic challenge? Or what if they're taking a medication that's contributing to their weight? Or what is this? And they'll always say, well, that's only a few people. That's only a few people. But by all the examples I give, in the end, it's probably the majority of people who actually have these complicated situations, not the simple ones they're talking about. It is not perfect. But it is what I found is my number one go-to tool on an individual basis. Now, if we're talking about interventions on a kind of a global basis or a larger scale basis, I think we have to go straight to education, as I mentioned earlier, whether it happens in medical training and or in our school systems for your children, where bullying is something that's now talked about in many school systems, but It is bullying about gender and religion and other and racial and ethnicity, kind of issues. It's not talked about with weight. Weight is really the original form of childhood bullying, and that's another intervention where I encourage people, especially our members, to go talk to their school boards about, hey, can we change our anti-bullying program to actually make sure it includes some information about weight-based bullying, because that is missing from too many of those programs. I have a school-age child, and I saw their anti-bullying materials, and there's nothing mentioned in there about weight, and that's the original form of bullying.
Perfect, thank you so much. We have a question from Divya here. You mentioned quite a few resources in the test, and she's asking, would you encourage us to use the test that you mentioned earlier with our colleagues to prompt awareness around their own bias, or any other tools that you would suggest, please?
Yeah, so I think one of the things that, the implicit association test, you can go to projectimplicit.org and you can actually download that test and do it online. It is just a shock value very quickly. When I deliver it, and I usually deliver it on paper when I do it in person because people don't want to turn it in and be graded on it. But when I deliver it in person, it really shocks people into recognizing they have bias. Some people say, I have no bias at all. I'm perfect. I'm a great person. I treat people with dignity and respect. And then they start to complete that test, and it's very obvious when you take it, because it's a word association thing. As soon as you take it, you have a problem, right? And then it shocks you into listening to a conversation like the one we just had to say, maybe I'll be a little bit more open-minded. So I do think that implicit association test is a good way to go to shock somebody into thinking a little bit more about this.
Great, thanks. Obviously, you mentioned that a contact with health professional is quite crucial. Is there anything would you suggest to train health professionals? We have Emil here who is asking, do you have any training practice of addressing this subject to the doctors or other healthcare professionals? So
curiously, OAC actually has a training that's in development right now that we're looking forward to bringing forward towards healthcare providers. But I'll give some basic advice, and a lot of it, again, in the U.S., there have been these new competencies that have been developed around obesity in general that include recognizing bias. But just a couple of simple things that healthcare providers should think about that maybe they don't think about always. And obviously, I mentioned the language things earlier, and that's probably one of the easiest things to do. But there are basic things around like office setup. Like you need to have chairs that actually accommodate people of different body sizes. Think about your scale procedures. So when you weigh someone, so first of all, I know in my provider's office, I've picked on it many times for doing this, the scale's kind of out in the open, right? And I'm not particularly comfortable in being weighed in front of people. So think about how you have your scale set up, and then think about, does your scale accommodate people of larger body sizes? And if not, do you have access to one? And, can you make that change? And then second, maybe a simple thing would be just to ask people's permission to weigh. We don't ask people's permission to take their blood pressure, and I realize that, but taking your blood pressure is not stigmatized. Being weighed is stigmatized. So some simple things along those lines. Now the question keeps getting asked is, well, what happens if they say no, they don't want to be weighed? Well, then the provider then has to have a conversation about, you can use that information to say, hey, I noticed the nurse wasn't able to weigh you today. Why was that? Let's talk about what that is. And maybe that leads to that next level of conversation. I do, though, then go all the way back to the very beginning of what I said earlier about the complexity of obesity. I think bias will disappear when healthcare providers, especially among healthcare providers, when they better understand the complexity of this, and they understand the treatments that are available. And maybe that's another thing I should point out, is that when we have more treatments that are effective, I think some of this bias will go away. The simple reality is that we do not have a treatment for obesity that works for everybody. No matter how great you think your program is, if you're a healthcare provider right now, you do not have 100% success rate. We turn people's stomachs into golf balls and reroute their intestines, and some of them still have obesity. And so as we get better with the interventions, maybe too, that'll take away some of the stigma as well. Because right now, the easiest thing to do is, if an intervention doesn't work, is to blame the patient, when the reality is we should be blaming the intervention for having responders and non-responders.
Thank you so much for this. We have 2 more questions which are very closely related, actually. So it's about how to start. So how would you start as a health professional to communicate with your patient about obesity without causing stress or stigma? And what sort of language would you use for that? Thank you.
Yeah, so I think I mentioned earlier the idea of if there's an intake form to actually ask, is it okay if we talk about your weight today? But I think that question, is it okay if we talk about your weight today, is really a nice general terminology that, you know, opens the door for that conversation. I think you could add some language to that to say, is it okay if we talk about your weight today? And by the way, I'm not here to judge you. I'm here to work with you and try to help you through this. I think if you see and you actually follow model interviews, you often see patients react visibly to some of these conversations because they've had bad experiences in the past. So you might hear a healthcare provider suggest, hey, let's talk about exercise, and you'll see the patient kind of, you know, cringe a little bit or something along those lines. And you have to pick up on some of those cues to say, hey, wait, did you have a bad conversation about that? So maybe let's not talk about exercise. Let's talk about increasing your physical activity and not about, you know, you going to the gym, you know, 7 days a week for 30 minutes kind of thing. I don't think it's a perfect science. So all of us with obesity are different. And I think that's the hard part. Standardizing this is going to be a challenge. But I do think that simple question, just saying, hey, is it okay if we talk about your weight today? And again, if they say no, to say, look, this is a safe place for you to have that conversation when you're ready. I'm here. We can do this together, and I have tools to help you. You know, that will, in most cases, will actually get the patient to open up right then and there. And if not, hopefully they come back the next appointment and are willing to have that conversation.
Brilliant. Yeah, I totally agree with you. I think if a doctor would face you and actually, you know, level up with you and invite you to open up, you know, earn your trust, I think any patient would open up. We have one more question here from Nick. Where does weight bias has the most impact on an individual? Is it social situation with their doctor, or is it media portrayal?
Yeah, so I mean, it is interesting to argue about where the most impact is. So I mean, I think if you talked about health, you know, obviously it can be because of the healthcare provider and that they haven't delivered the care you need or given you the tools you need, or you can't utilize them because of their past circumstances. But again, many young people tell me, especially people who are in their 20s and 30s, where the health consequences of obesity maybe haven't manifested themselves as severely as they do for older people, that it is the social consequences of bias that impact their lives the most. And there may be gender differences in this as well. So it seems as if, you know, men with obesity are usually motivated by a health event to try to address their obesity, and women have some motivations around social issues. But again, everyone's so different. Not everyone with obesity is the same, so it's hard to measure that. But I think it is an equal balance between social issues as well as health issues, and it is the underlying challenge. So bias is the underlying challenge with everything I think we do with obesity. The reason why we haven't been successful in addressing this condition globally as a society as well as individually is the roots of that are bias. And you know, if we can start chipping away at bias, then I think we can make progress on both the individual and global efforts to address obesity.
Great. We have one more question here from Susan. Joe, you've been very popular today. So there is a question about, again, talking with your doctor. So would it be preferable to find the cause for the individual carrying excess weight and address that first, I guess, as a health professional?
Yeah, so I mean, it's an interesting question. So I mean, so why people carry extra weight or have obesity? Can it be because of a medication that you're using to treat them for something else that causes them weight gain? And obviously understanding that and letting the patient know that, hey, maybe this isn't some, you know, you probably think it's your own fault that you've gained this weight, but it's actually this medication you're taking is contributing. I think that would help in the conversation. But I also think it's important to recognize that some of us, you know, carry extra weight for really complicated reasons too. So we might have had an adverse childhood event or trauma in our life or something along those lines. And the reality is, in order to address their obesity, you're going to have to address those issues first as well. So I do like this idea of at least, I don't necessarily know that you'll always find a cause, but trying to identify a cause beyond some failure of personal responsibility by the patient is a good place to start, in my opinion. The reality is that, again, if we knew all the causes of obesity, we'd be able to solve them a little quicker. We don't know them all yet, but I do like the idea of looking at the individual and saying, hey, what's at the root cause here? It's not a bad idea, in my opinion.
Sorry, I promised it would be last question, but we have just one more question, and we have like 1 minute left. So if you mind, Joe, it's a question from Stuart. So Stuart mentioned that you noticed quite a few terms that you use for obesity. It's obesity, larger bodies, weight, extra weight. So what terms are acceptable?
Yeah, so I think all the ones I mentioned there are good. The ones I would encourage you to avoid, although some people try to claim the word fat, it does offend many people, so just something to keep in mind. So definitely don't call someone fat. Again, don't call someone obese. I mean, they have obesity, right? We don't say someone's cancerous, so I would avoid that. Watch, when you say unhealthy and things along those lines, and then a word that the surgeons used is a challenge. They use the word morbid or morbidly obese. And again, that word, I use the word severe obesity and it's replaced, because not everyone who has a larger body size is morbid because of their larger body size. So those are the words I would encourage you not to use. And I will say that even the word obesity, you use it in a clinical sense. I mean, you're probably just easier just talking about weight in if it's any sense other than a clinical sense.
Great, thank you so much. I'm very curious to ask you, I'm sorry, this will take a bit longer now of your time, but you mentioned quite a lot that weight bias is particularly prevalent amongst females. And I was just curious to know what would be, I guess, tools or ways you would approach a patient who is female and with her excess weight. Is there going to be any difference the way you would approach this?
Yeah, so I think what the knowledge that it would be is they've likely had a bad experience in the healthcare provider's office. So I think you need to make that experience as comfortable as possible, and then maybe start in a way that is about kind of getting them to open up around the topic more than you forcing them into a conversation. I think that's the best advice. Again, everyone's on an individual basis to have that, so it is really hard to do that. I will say that if we took the difference between men and women, so men are often the folks who don't go to the doctor until the last second, right, kind of thing is a perception that's out there, true or not. And so maybe the conversation's easier with men, but I'm not 100% convinced any of us are particularly comfortable having the conversation. But with women, I would just urge that caution that they've likely had a really bad experience in the doctor's office before.
Perfect. Thank you so much, Joe. Thanks once again. And as exciting as it is, it's time for us to wrap up. I'm sure our listeners really enjoyed listening to this talk tonight and sharing your insight into weight bias. Thank you all for listening and participating with your questions. For all of you who would like to listen to this webinar once again, we'll share a recording of it in the next week or so. So please keep an eye on your email inbox. If you are not a CCH subscriber, make sure you sign up at www.contemporaryhealth.co.uk/preferences. We hope you enjoyed this webinar, and if you would like to see more of such webinars in future, please tweet us your feedback using @CCH Health handle. Otherwise, you can email us as well on info@contemporaryhealth.co.uk. And if you'd like to get in touch with Joe, Joe's Twitter account is @Obesity Action, and the email address is info@obesityaction.org. So this was the College of Contemporary Health, CCH, facilitating the weight bias webinar with Joe Nadglowski. Thank you very much, Joe. He's the CEO of Obesity Action Coalition. Thank you very much, and I hope you have a great evening. Thank you very much, Joe.
Thank you. Thank you for having me. Have a good night.
Good night. Cheers. Bye-bye.